Well, good afternoon, everyone. I'm just going to begin by letting you all know that we're just going to mute everyone's lines at the current moment, and this is meant to minimize any background noise during the presentation part of the webinar today. And when we open the line up for dialogue and questions, we will unmute the line.
The conference has been muted. La conférence a été mise en mode discrétion.
Well, good afternoon, everyone. It's my pleasure to welcome you to our second webinar in a series of webinars led by RNAO regarding the welcoming of Syrian refugees. My name is Tim Lenartovich, and I am the Director of Nursing and Health Policy with the Registered Nurses Association of Ontario. I just want to begin by letting everyone know that this is a webinar, and so there is an online component, and so hopefully you have logged into the WebEx portal and have an opportunity to view the slides. I'll also let you know that this webinar is being recorded and will be available for retrieval from folks who were unable to join us this afternoon. So any questions that you do ask will be recorded. So I want to begin as well by letting everyone know that I'm being joined by our colleague Chantal Chisholm. And Chantal is a RN and RNAO member, and she has direct experience working with welcoming Syrian refugees given her role with Scarborough Healthy Communities. And Chantal will be presenting immediately following my remarks and will provide a first-hand account of her experience. But to begin with, I'd like to kind of set the context and explain a little bit about how we've gotten here. And I can't profess by any means to say that I'm an expert on welcoming Syrian refugees. And the purpose of this webinar series, rather, is to bring together people who do have that expertise, and it's our role at RNAO Home Office to create the forum for that dialogue and for that discussion. So to begin with, you'll see on the slide, we have an overview of RNAO's ends, and these are the strategic objectives of the association. And you'll see here that speaking out on emerging issues and influencing healthy public policy, as well as advancing the role and image of nurses, are all key objectives for the association. And so we take a very strong interest in welcoming and supporting refugees for a number of reasons. We know that it is an area that a lot of our members are very passionate about. They have experience in this area. We also know that when we look at health from a health equity perspective, we need to look at health disparities, and some of those disparities are looking at who has some of the greatest challenges accessing health services. And we know that refugees often have a number of health concerns, have often been witnessed and experienced very chaotic and in some cases disastrous circumstances within their countries of origin. And so really there is, I think, a lot of opportunity to ensure that their health needs are met, while at the same time welcoming and embracing them to Canadian society. Of course, a hallmark of being Canadian or an Ontarian is diversity, and we welcome and respect the diversity and multiculturalism that I think that has really defined a lot of the Canadian fabric. And so RNAO has been a very active voice in supporting refugees. Under the previous federal government, when cuts were made to the interim federal health program, and this is the program that provides refugees with access to health care services in the country when they arrive, we were very concerned and we spoke out against those cuts. In fact, we were actually intervener parties to a legal challenge that was happening to restore those services. And so ultimately we didn't end up going to court because the current government actually restored the interim federal health program, but we were there and prepared with our colleagues from the Canadian Association of Community Health Centres to pursue that route if needed. So in terms of some of our efforts to date to support welcoming Syrian refugees, we were very excited to partner with the Ontario Medical Association on a joint media release where we essentially announced that we are ready and excited to be able to support the integration of Syrian refugees. We've been quite involved in speaking to the media and ensuring that the public is aware of the important role of nurses in supporting refugees. And this has been complemented by our use of social media. And for any of you out there who haven't had a chance to follow either RNAO or our CEO, Doris Grinspan, I would really encourage you to do that on Twitter and on Facebook as well. We've also sought out volunteers who are interested in getting involved, and some of whom are going to be included within the webinar series as presenters, given their experiences within supporting refugees. And of course, this webinar series as well are just some of the activities specific to welcoming Syrian refugees. And of course, our history with refugees in a more general sense is also quite extensive. We are in a regular dialogue with the Ministry of Health and Long-Term Care, and we initiated that dialogue many months ago, and we continue to attend weekly calls that are organized by the Ministry. We receive daily updates from the Ministry of Health and Long-Term Care on the integration of Syrian refugees, and we also are involved in different stakeholder advisory tables with the Ministry to ensure that the voice and perspectives of nurses are reflected within decision-making and ensuring that Ontario's health system is optimally configured and mobilized to support Syrian refugees. As well, we've also made available a number of our resources, best practice guidelines, and whatnot to support health service providers, specifically registered nurses, nurse practitioners, and nursing students in the care delivery of for refugees. And we actually sat on a specific working group around health education. As well, we've been supporting service provider organizations who are needing access to RNs and NPs. And so one example here is on the slide, Access Alliance Multicultural Health and Community Services, who were seeking RNs and NPs who are fluent in Arabic and interested in volunteering at one of the 5 hotels that were housing Syrian refugees in February. And we were pleased to provide the link for that service provider and also recognize that in addition to Access Alliance, there are other very important service providers who are delivering that care, one of whom we have a representative from today, Chantel, who will be talking more in just a moment. We've included some information on welcoming Syrian refugees in the Registered Nurse Journal, and the gentleman who is featured in here, or Captain rather, Tyler McNaughton, who's a nurse generalist in the Canadian Armed Forces. We're actually quite fortunate to have Mr. McNaughton participate in the webinar later on in this month, because this will be the 3rd in a series of webinars. So that brings then to, I believe, the final slide for me. And you'll see that we had our initial webinar on February the 18th, and we have, of course, our webinar right now on March the 8th at noon, and then our next webinar, which will have Captain McNaughton will be on March 21st from 5:30 to 6:30. If you are interested in participating in that webinar, we would love to have you. Information on how to register was previously sent out. Just like you registered for this one, feel welcome to register for the next one, and then our final webinar will be on April the 21st. I will be co-facilitating the March 21st webinar, and RNAO CEO Dr. Doris Grinspan will be co-facilitating the April 21st webinar. Fantastic. So, at this time, I am very pleased to introduce and welcome Chantal. Chantal is an RN, as I mentioned. She practices within primary care with the Scarborough Centre for Healthy Communities, and she has been involved directly in the care of Syrian refugees. And I've asked Chantal to explain a little bit more about her role and her organization's role in delivering care, and to provide us with some insights in terms of what they're seeing, any observations that they have, insights into what's going on, in hopes that this can provide you with some information in terms of welcoming Syrian refugees, either within your practice setting or even just more generally in terms of in your community. So at this point, I'm going to ask Chantal to open up her line, and we do have your presentation that should be on the screen now. And Chantal, if you just want to maybe say slide, and then we'll be happy to advance the slides at this end. So over to you.
Great, sounds good. All right, can you guys hear me?
They're currently on mute, but we can hear you perfectly.
Okay, perfect. I didn't know if I should be on speaker or just over the phone, so I'll just keep it as is.
Great.
All right.
Chantal, you still there?
I'm here.
Go ahead.
All right. Welcome, everybody. Thank you for joining me for this. My name is Chantal, as you can see. I'm a registered nurse here at the Scarborough Centre for Healthy Communities. We are a nonprofit organization in Scarborough. We actually have 3 different community health centers. So I work at one of them. Just every day, our priority population is immigrants and refugees. So this is kind of just a new phase of something we're already very familiar with. You can go to the first slide if you want. So just to give everybody a little bit of background about how this all got started, back in the fall, we actually started receiving privately sponsored refugees, and that was through coordination with the Crossroads Clinic through the Women's Health Hospital with the University of Toronto, and that was largely organized by Dr. Meb Rashid. So we were basically referred the refugees through the Crossroads Clinic, and one of our nurse practitioners here, Hilary Shackleton, was very involved in getting that all started. So this basically started from a one-day thing where we would see these privately sponsored refugees and their sponsors for primary care. And then once we got word that the government-assisted ones were coming in, we started planning to provide care within the hotels that they were staying in. So on January 12th and 13th, approximately 225 government-assisted refugees arrived at the Radisson Hotel in East Toronto. And we're actually, most of them are moving out now. They were supposed to be out by March 1st. I don't believe that's actually happened, but we are supposed to get another influx. So we will again be sort of starting from scratch with a new batch of arrivals.
Chantal, sorry to interrupt. We just had some feedback. If you could speak up a little bit. I understand some are having some difficulty hearing.
Yeah, it's kind of broken telephone, I'm sure. Okay, I'll do my best. I have a soft voice.
But right now, that's great. Right now, what you just said, so.
Okay, excellent. So like I was saying, we received 225 government-assisted refugees to the Radisson on January 12th and 13th, and we started our clinic on January 19th. And we based this model. Access Alliance actually had a nurse at the Toronto Plaza Hotel. They were the first hotel to receive refugees. So the model they were using was just a single nurse was there triaging something like 300 refugees. And then the idea was to transport them to community clinics just for further care. So she was basically doing triage, sending off urgent people to the hospital, and sending people who could wait a little bit longer into the community. So this is how we started doing it. It was myself, a nurse practitioner, Hillary, and my manager. You were basically following the exact same model, and it was extremely chaotic. Our biggest issue was with transportation, because all of them were getting sick at the same time, new environment, exposure to new bugs, so they kind of all needed to be seen. And the issue is most of them are young children, so they were getting severe fevers, and they really needed to be seen. We just didn't have a way to get them there. We had our own transportation service through our own organization, bringing them back and forth to our own clinic, but the capacity was pretty small because it could only hold like 6 people, and if any of them needed car seats, that really reduced the amount of people we could see in a day. Next slide, please. So we switched it up a little bit the second week, and it's kind of a dynamic process. It's changing all the time, but this is sort of how we're running right now, and it seems to be working. So we're there Monday to Friday, 9 a.m. to 5 p.m. We've still got one nurse and one provider. It started off as a nurse practitioner, but now it's a doctor just because that's who we were able to hire on short notice for a contract, a driver and a manager on site every day. So within the actual clinic on site, we deal with semi-urgent health concerns. Anything emergent is sent out to the hospitals, and anything that doesn't need to be seen the same day, just by nature of limited resources, they're booked in with a provider in a community clinic, and I'll touch a little bit on who these partners are in a couple of slides. So basically, the nurses roll in all of this. We have a great nurse. Her name is Olga. She's there full-time. She does the initial assessment and triage when the refugees come in. So they're set up in a double hotel room. So she's got one room with a little waiting room. She does the triage and vital signs. She conducts a nursing assessment, and then basically on that decides whether they need to be seen by the doctor on site. Her name is Laura Fung, or if they need to go to the ER, or if she can just book them in to the community for an appointment at a later time. She also performs health teaching, very important. There's not a whole lot of health literacy in this population. A lot of medication administration. It's basic stuff, mostly Tylenol. Wound dressings, there have been a lot of skin issues and a lot of sores. And then basically from there, they see the MD if it's required. So they would do the whole assessment, diagnosis, and treatment of semi-urgent acute issues. The next slide will kind of go through a little bit of what we've been seeing. We've got very little actually kept on site. It's not a big space, but we have everything we need to run a little clinic there. So what we're seeing, again, like I mentioned, I don't remember the statistics, but the majority of refugees are children, and a lot of them are under the age of 5. So we're seeing a lot of upper respiratory and ear infections. Almost everybody who walks through the door has something like that. A lot of strep throat. We've been getting a lot of positive rapid strep tests, a lot of positive cultures, and it actually prompted a public health nurse to come on site just to do a bit of surveillance to track these positives, and also to find out which strain it is, because we were having a little bit of antibiotic resistance. A lot of bronchiolitis, pneumonia, again, respiratory conditions, headaches, viral gastroenteritis, and giardiasis, a lot of parasites. Suspected pregnancy and contraception requests. We have actually midwives on site once a week, so they're kind of taking over the care of the pregnant clients, but a lot of them have run out of their contraception, and it's definitely a big concern right now. We're getting a lot of questions about it. A lot of prescription renewals. If it's not urgent, we're just sending them into the community to do the renewals and all their primary care there. There's a lot of antibiotic misuse happening. They were able to get antibiotics over the counter. Most of them are coming from Lebanon and Jordan. And they just have stocks of it, and they take it for everything. So they've got the sniffles, they've got a headache, sore throat. They kind of pop it like a vitamin. They'll take it once and then not again. So there's a lot of education happening around proper antibiotic use. A lot of severe dental problems. Again, I'm going to mention our partners, but we've been sending them to a lot of emergency clinics because there's extensive dental issues going on and a lot of dental pain. We've been seeing thalassemia, iron deficiency, a lot of malnutrition and genetic things, scabies and lice. So they're anywhere you're living in close proximity to other people, especially with children, these things kind of just get spread. A little bit of varicella. We've been hearing that they've been getting more of that out west. We haven't seen a lot of it, but it has been cropping up. And then obviously a lot of mental health issues and trauma that I'll touch on a little bit later. We can do next slide. Good. So we've got a lot of people helping with this. We are on site, but COSI is also on site in another hotel room. They've been there from the beginning. They're a settlement service. They're there 24/7, providing information sessions, assisting with finding housing. They're assisting with everything, really. They've got supplies on site, things like diapers, clothing, toothbrushes, toiletries, and they also help coordinate some of the transportation out to various appointments and even things with finding nearby walk-in clinics and pharmacies. So like I mentioned before, Toronto Public Health, a dental clinic was on site for a few days. I don't believe they're still there, but I'm sure they'll come back with the next wave to triage adults and children, and then they were sending them out to the Scarborough Civic Center. We've also got a few dentists who are providing some compassionate care in the community, just because it is a big concern in this population. Toronto Public Health has also been on site to do vaccination clinics. So that's one of the big things we do even in the clinic on site. They are only providing the ones that will cause major outbreaks. So things like flu, MMR, varicella, and Menactra. So they're not providing tetanus, diphtheria. We do that once they're seen in the clinic with us in the community health center. And like I mentioned, the health inspector came on site, and that was prompted by the strep outbreak, which we're still seeing. It's ongoing. So they were doing a lot of teaching about hand hygiene, proper hand washing, proper sneeze etiquette. And in terms of the hotel, unfortunately, the rooms weren't being cleaned properly. So we had to do a lot of education on that, making sure soap was available to the residents. So that seems to be getting better. The midwives, like I mentioned, they see prenatal patients every Wednesday, and they've got a whole network of covering midwives that they're referring out to. So we're pretty lucky in that respect. We haven't been seeing a lot of pregnant women. I know some of the other sites are seeing more of them, but it's a great resource to have. And then sick kids. We had several children with leukemia and a couple with some rare genetic diseases, and they were connected right away to sick kids. Next slide, please. So these are just some more of our partner agencies within Scarborough. So like I said, we've got 3 community health centers. So all of our providers are on board. The refugees are being referred out to us to have their primary care and to establish more permanent care. Taibu CHC has also been involved. Dr. Paul Colford, he works at the Canadian Centre for Refugee and Immigrant Healthcare, and he was a huge help, especially in the first week. He was just seeing so many clients every day, as much as we could get transported out. So he's been a huge player. The Hong Fook NP-led clinic, and then there are several Arabic-speaking doctors in Scarborough who have agreed to take on some of the refugees, which is great because almost none of them speak English. So once they have been triaged by the nurse at the hotel and they've either seen the doctor or gone to the ER or their immediate issues have been dealt with, then the nurse and medical secretary book these clients into the community in any of these above clinics. So once they're received here, they do a full intake, full health history, they receive their vaccinations, blood work, and STI testing as per the guidelines that were largely developed with the help of Meb Rashid at the Crossroads Clinic. STI testing is very important. They've been doing it even in some young teenagers. There have unfortunately been a lot of cases of sexual assault in some of the refugee camps, so that's been a big concern. It's just getting them tested as a baseline. And then, of course, we do the regular primary care. So this is where we do the prescription refills, chronic disease management, all of the regular EMSA cancer screening. So the first appointment that they have in the community is arranged by the hotel staff, so by the medical secretary, by the nurse, by Costi, and one of our transportation, so one of our own house buses will bring them in. But all follow-up after that is arranged via normal processes. So this would be TTC or taxis. We provide tokens or taxi chits, but the idea is to try and empower them a little bit to start figuring out how to get to these appointments on their own. Next slide, please. So in terms of some pearls of wisdom about seeing refugees, again, these are guidelines we follow most of the time because most of our clients we see here are refugees. So one of the big things, they're coming from war-torn regions. They've seen a lot. Most of them, are a little bit traumatized. But the idea is we don't assume. We screen for post-traumatic stress disorder and mental health concerns. But you'd be surprised at how resilient some of these people are. So it's just regular screening. Like I mentioned, strep is a big issue. So if you are seeing these clients and they are complaining of sore throats, we definitely recommend rapid strep tests if you have them. It just helps to prevent the delay of treatment while waiting for a culture. One of the things we've been seeing is that their Centaur scores, which is one of the ways we assess how likely they are to have strep based on their symptoms, their scores are actually quite low. So for example, if a normal person who has a score of 2 doesn't usually have a positive test, but they are having them. So their symptoms aren't as severe, but they do seem to be actually infected with strep. So rapid strep tests are great. Like I mentioned before, birth control is a big concern with these females. They are asking for it. So it's a good thing to discuss with any females of childbearing age. They were seeking condoms, and we did have a bowl out for them to take, but culturally it's a little bit taboo, so they weren't comfortable with taking them when other people could see them. So we now offer it to them in the private appointments. We just offer free condoms to them. So again, monitoring for regression in children, so this is things like acting out, bedwetting, refusing to eat. We haven't been seeing a lot of it. Mostly we've been seeing issues with them eating because they're not used to our diet. They're not used to our food, and it's been causing a little bit of stomach upset. So again, take it for what it's worth. Prioritize their concerns first, and this really fosters trust because when we see them, we're really focused on getting the vaccinations done, getting the blood work done, screening them, but they might be concerned about their eyes, for example. And if that's brushed aside, it kind of fosters resentment and a feeling of not being heard when, there's already language barriers and things going on. So just prioritizing their concerns. Book longer appointments. We give them an hour, which I know isn't always feasible, but we do book longer appointments to accommodate language barriers and just how many things we have to go over and cover. We use a phone interpretation system unless we can get an actual in-person interpreter, which is preferable but not always possible. But like I said, almost none of them speak English. And then connecting them with social supports. and information about the Ontario healthcare system is really key. The more they know, the more they can kind of take on themselves. It's, we take our system for granted. We know how it works, but it's kind of a maze to them. So again, we're trying to educate them and empower them to, do things like going and picking up their prescriptions themselves, because they were coming in and asking the nurse to go and get their prescription. So just educating them on that. And just a comment about prescriptions. Through their IFH coverage, they get whatever is covered under the Ontario Drug Benefits formulary. So for nurse practitioners, when you're prescribing, you can use that formulary to find out what they would have covered. It's just helpful because they really do not have a lot of disposable income. Next slide, please. And then in terms of some social tips, so the first and foremost one is talk to them, reach out. They have a story to tell. Most of them want to talk, want to tell their story, and want to find out about you and Canada and the community. So just welcoming them, this fosters the sense of acceptance and being part of the community. Because there's so many children, we really encourage children to get involved with welcoming them. And I know some of the schools around have had welcoming events and parties and lunches. So just getting the kids involved, and even if you have children and you know that there's refugees at their school, just encouraging them to include them, to make them part of the school community. Like I mentioned, food has been a bit of an issue because obviously our diet is very different. If you're willing and if you know any refugees, to look up Syrian recipes and food and to bring it to them. Food is connection, it brings people together, and it's a comfort to them. It's something familiar. Like I said, getting around has been a bit difficult for them. If you can offer to drive them to doctor's appointments, grocery store, wherever, or even accompany them on public transportation, just so they get used to how it works and feel more comfortable doing it themselves. Donations are a big thing. The Syrian Relief Fund that I mentioned, their deadline was on February 29th, so I'm not sure if that's still going, but you can go onto I have it here, the Global Affairs Canada website. They can give you a list of registered Canadian charities so that it makes sure your donations get to where you want them to go. But even things like food, furniture, clothing, all of those are super helpful. Donating anything you can. They really can't afford to buy anything. If you do speak Arabic, volunteering to help them with English or French training, even if it's just informally or helping with a neighbor's homework, we really need people who speak Arabic to pitch in just to bridge that gap. And then on a very broad sense, just showing your support and helping to break down some of the myths and prejudice that unfortunately is going on. As nurses, we understand the whole holistic viewpoint. We understand how all of the factors in their life affect how they can cope here, their physical health, how they connect to us, how they make friendships. And we can be really good advocates for them because we understand that. And, if you hear something a little unsavory, just educating the people around you really helps. Like, they have come to escape something really, really horrific, and they just need our help and our support and our empathy. So just being clear that they're not out to get us. It's pretty sad, some of the things we've heard, but most people are pretty supportive, and the refugees are really, really appreciative of the care they've been getting. So that's about it on my end. I'll turn it over to you guys and to Tim.
Great. Well, thank you so much, Chantel, for that very informative presentation. And I really just want to commend yourself, the team at the Scarborough Centre, and many other service providers who are kind of on the ground and leading the charge, so to speak, in terms of providing health services to Syrian refugees as they become accustomed to Canadian society. And just before we open up the lines for some questions and comments, there's a couple of questions that I had maybe to get us started. And
Sure.
the first, you've touched upon this, but I'm wondering if maybe you could expand it a little bit more. And this has to do with orientation to the Ontario healthcare system. And you mentioned before around antibiotic use as one example, and how overseas antibiotics are available over the counter and are misused, it sounds, quite frequently. And actually that's a bit reminiscent of the Canadian context, and perhaps some may still think that we are overusing antibiotics, but I know certainly there was a time in the early 90s and beforehand where antibiotics were readily given for anything. And now certainly over time things have changed. So going back to, tell us a bit more about the orientation to the healthcare system. How is that going? How are the clients, do they know about what is an appropriate use of an emergency department, their primary care provider, what's that? What is the role of public health? How is that going, and any insights into that?
It definitely has been a little bit challenging. We've been having, like you said, with ERs, we've been having a lot of them kind of inappropriately using ERs and showing up at the ER for every little thing, and obviously they're wasting a lot of time sitting there, not to mention resources. But we've been relying very heavily on our social workers. They have a lot of that information to connect them with. They've got a lot of helpful tip sheets in Arabic, which is key. But we've been relying heavily on our social workers to sort of disseminate that information, as well as the nurses when we see them. And it's kind of coming up as like an as-needed basis, because there's just so many things and so much information being thrown at them. So it's kind of I don't really know how to answer that question, because it's kind of a work in progress, to be honest.
Absolutely. And I think that there's an opportunity for all of us as registered nurses, nurse practitioners, and nursing students to help provide that orientation, that system navigation piece.
And our nurse on site, Olga, the one who's working in the hotel, that is part of her role as well, is explaining, what the difference is between the doctor at the hotel, which is an unusual circumstance, versus what, a doctor or a nurse at the CHC will do versus what a doctor or a nurse at the hospital will do. So she is doing a little bit of that introductory information, but it's connecting it all together and getting them to understand why they need to go to all these different places for different things, because it's fragmented. They go to a different place for dental care and for eye care than they do for, their prescriptions.
Yeah, great, thank you. Can you tell us a bit more about the spirit or the kind of the attitude that the Syrian refugees have? They find themselves having gone through, I'm sure, a tremendous journey to get to Canada. What's the spirit like?
To be honest with you, I'd say the privately sponsored refugees are handling this change a lot better. They've got that constant support, and they're settling in really well. They're really appreciative. They're getting connected to schools and to different community organizations. The ones in the hotels, they're hopeful. They're happy to be here, but there's a sense of being a little bit stuck and a little bit lost, because they are kind of chasing the information. They don't have that constant support the way the privately sponsored ones do. And I know a lot of them are, really anxious to get out of the hotel, which I can't blame them. So I think once they get their own place, it'll be better. But the kids, they're pretty amazing. They're pretty resilient. They're happy. They're goofy. They're running around and playing with each other. So I think that helps bring everybody's spirits up.
Great, fantastic. Before we go to open up the lines, Josephine, is there any questions that have come through on the webinar platform? And I should also take this opportunity to let everyone know and to thank very much Josephine Moe, who is the Executive Assistant to RNAO's CEO. And Josephine was critical in coordinating the webinar today and the registrations. So thank you, Josephine. And what's coming through on the webinar platform?
Okay, so one of the questions that was submitted is, how do RNs and student RNs get involved with helping firsthand with the refugees?
Chantel, over to you.
All right. I think it depends on your workplace. Obviously, if you're working with them in your workplace, that makes it really easy to connect. If you've got the time to just sit down with them and ask them if they've got any questions, because in a lot of places there isn't a lot of time for that one-to-one undivided attention. If that is an opportunity for you, please take it. They really need somebody to sit down with them and explain some of these things. And I think that's a role student RNs could really be helpful with. And then in terms of outside the workplace, you know, some of the social things I touched on is get involved with charities in the community. If you know of any, I mean, Google is a great thing. If you know of any organizations that are running any events for them, asking if you can volunteer. For example, in Toronto, they've got the Syrian Community Center that's actually right beside the Radisson Hotel, and I know they're running quite a lot of programs for them. So even things like that, just calling around to City Hall, finding out if they're doing anything, and just offering a hand.
Great. Josephine, another question.
Yeah, so our next question is, can you talk more about how the team deals with mental health issues? Any resources you use?
Mental health is a tricky one because obviously it's an area where there really is kind of a gap to begin with. So I wouldn't say we've got a huge number of resources, but we're lucky in the CHC because we work with a team here, and we've got social workers here, we've got sexual assault and domestic violence workers here. So we're lucky in that we can draw on their experience. We've been connecting through CMHA, so the Canadian Mental Health Association. I know that they're running some programs and offering some time with their social workers and psychiatrists. But honestly, it's kind of taking it day by day. It's screening, it's advocating for them, it's referring out to appropriate resources in the community, and we've been relying very heavily on, again, our social workers, CMHA, and the Crossroads Clinic in Mabrasheet.
Are there any specific resources or tools, Chantel, that you're using to help with mental health?
On me personally, no. I wish I had more information on that, but unfortunately I don't.
Okay, well, I think that's a very important question, and one that I've written down here myself to get us thinking about, you know, what way can we get involved in terms of looking at sharing of tools and resources. Certainly RNAO's best practice guidelines, and we do have a number that do deal with mental health, I think would be a very good place to start. But we'll also do some more looking into that one. Josephine?
The next comment is, thank you, Chantel, for your presentation. Something I've understood is that some refugees do want to share their story, but for many it may be too raw and too triggering at first. Could the healthcare information you have created in Arabic be posted?
Chantel?
I'm sorry, which healthcare information are we talking about?
I'm not sure. This was one of our questions that was presented from one of our participants. Any of the resources or anything that you're using that are in Arabic, are those being shared or disseminated?
I think they've been disseminated with the partners. I know that we had some information about contraception, some information about vaccinations, information about hand hygiene and those sorts of things. Those were translated into Arabic, and I know they've been disseminated amongst us. I don't know if there's anywhere broader that they're available. One of the other issues we've had is that not all of them are literate. So we were posting some of these things around and then realized that they couldn't even read them. So I think Arabic information printed information is helpful, but also having somebody who can verbally speak Arabic is helpful as well. But that's a really good question. I don't know if they're being disseminated widely.
Can we ask you, Chantal, if you don't mind, to when you're back with your team, maybe asking that question if there is anyone that's housing this information, and if so, if you could let us know, and we'd be happy to share links with the participants on the call.
Yeah, that would be great.
Thank you so much. Josephine, is there any other questions on the webinar?
Yeah. So just in continuation of that topic, someone submitted the comment that health information is available in Arabic on the Sick Kids website, and also mental health information in Arabic is available through the CAMH Center for Addiction and Mental Health website.
Fantastic. Josephine, would you mind maybe retrieving those links, please? And if you could send them out to the participants in a follow-up, that would be fantastic. So we'll make sure that you get those links, and thank you to the participant who has flagged those.
Thank you. That's great.
And if anyone else on the line has additional resources that they know are available online and want to identify them, that would be fantastic. Josephine, do they have your email address?
They might not, but I could post it up.
That would be great. So Josephine's going to post her email address, and if you do have things that you're able to share, if you could send them, please, to Josephine, and then that way we will disseminate them amongst all the participants on the call today. Good. So I think maybe at this point we have about a little more than 10 minutes left. So I'm wondering if we could take maybe a couple of questions over the phone. We're going to unmute the lines now.
The conference has been unmuted. Le mode discrétion a été enlevé de la conférence.
All right. So this is your time now. If you want to ask a question of Chantal or myself, or if you have a comment, feel free to go ahead.
Hello, this is Anne Morehouse. I'm with a synagogue, and we're expecting a Kurdish family. And I'd like to know if you have any experience with Kurdish families.
Chantal, do you have any experience?
I personally actually don't.
Mm-hmm.
Yeah, I'm sorry, that's a blank spot for me.
Mm-hmm. Is there anyone on the line who does have experience with Kurdish families?
Well, when we have some experience, we can share it with everyone.
We'll be the one. We'll look to you for that guidance. You know, if you want to, Josephine's going to put her email address up. If you wanted to send us a note, we can certainly go through our networks and see if there may be someone we can connect you with.
Thank you.
Questions or comments, or something that someone would like to share, an experience that you're having, or a discovery of a resource?
Hello?
Hi there.
Hi, sorry. Just had a quick question about where the refugees are being placed. I'm from Waterloo, and so I'm not sure how many are actually coming as far out my way yet, but I'm just wondering if anybody knows how many are coming out to KW, Cambridge area.
Does anyone have any information on that?
Can I just speak quickly about that?
Sure.
I don't know exact numbers. Obviously, from what I understand, we're expecting more like in the big hubs. So again, in Toronto, in Ottawa. But I do know that when they're looking for housing, they're kind of looking all over Ontario. So even personally, we've sent some to London, to Windsor. I'm not sure if any have gone to Waterloo, but they're kind of going where they can afford the rent. So I can't give you exact numbers, but it is very possible that they could show up really anywhere.
And we in our daily briefings with the ministry, we do get some, I think, general insight in terms of geographic distribution. And so to whomever had asked that excellent question, if you wouldn't mind getting in contact with Josephine, her email is up on the screen now, and let us look into it, and we can certainly provide you with the background information that we're able to find. Josephine, is there any outstanding questions from the webinar? And I'm getting a nod, so yes, there are. So we're just going to bring up another question from the webinar. So go ahead.
Okay. The next question is, do you have a specific assessment tool you use for initial screening, or do you use the same assessment tool you use at the clinic and add certain questions for refugees?
Yes, we actually do have a specific tool, and I'm not sure if that's something Crossroads Clinic has already made available, but if not, that's definitely something I can get. We have a triage form that was actually made in-house for the nurses at the Radisson Clinic, so that's just for like a quick physical triage. But in terms of the actual full intake and health history, that was developed, again, through the Crossroads Clinic, and we're all using the same one. We use Nightingale On Demand as our EMR, so it's actually a template within our system, but I know that there are just physical copies. That's how we started, and the idea is we want consistency among all the sites for our intakes. It helps with statistics and information gathering and dissemination.
And I think we have time probably for, I think, one final question.
Okay. How important is it to have a professional translator for medical appointments? This individual says their organization is sponsoring refugees in a rural setting.
All right. It's one of those things where professionals is great. It's preferable because sometimes they're better at interpreting some of the more complex medical terms. Obviously, with a situation of this scale, we're kind of taking any help we can get. Obviously, all of our volunteers are screened, but they're not necessarily professionals. Like, we've got community members from the Syrian community who are helping out at the hotel, for example. So it's, you kind of have to take it with a grain of salt. Some of the complex stuff might get a little bit lost. So when we're in the clinic, we do use a professional interpretation service, but I know it's not always possible.
Great. Well, I'm seeing here we have about 3 or 4 minutes left, and I want to be very mindful of everyone's time. So I would like to draw the webinar to a close and thank each of you very much for participating this afternoon. This is the second of 4 webinars. The next one, as I mentioned, is on March the 18th, Josephine, is that correct? March 18th? Josephine's just bringing up the slide here just to make sure we're giving you the correct date. Yeah. Oh, no, March 20th. My apologies. March 21st from 5:30 to 6:30 p.m. And we will have Mr. McNaughton, who will bring the experience from the Canadian Armed Forces in supporting Syrian refugees before they arrive to Canada, which I think will offer a very unique perspective. And I would specifically as well like to extend gratitude to Chantal. Thank you so much. We know you're very busy in the midst of things and do appreciate the time that you've taken to answer questions and appreciate your willingness to engage in some follow-up with looking into the sharing of resources. So thank you for that. As well, I'd like to thank Josephine Moe very much for serving as our coordinator for the call today and for helping to organize the questions. So we're going to stay on top of this opportunity. We see it very much as an opportunity to support Syrian refugees and appreciate all of your active participation today. And so for those of you who are able and interested, we will talk more on the 21st. Otherwise, we hope you have a great day, and we'll talk again soon. Take care.